Hello, everyone, and welcome to today's webinar, Church Reopening, Lessons Learned from a Pastor plus Insight from both a health and legal professional. Before we get started, I'd like to go over a few items so that you know how to participate in today's event. You've joined the presentation listening your computer speaker system by default. If you would prefer to join over the telephone, just select telephone in the audio pane and the dial-in information will be displayed. All attendees are in listen-only mode. You also have the opportunity to submit text questions to our presenters today by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. You all will also be unmuted at the end for our Q&A session to verbally ask questions as well. Today's webinar is being recorded. A copy of the audio recording and slide deck will be emailed to you within 72 hours of completion of this live presentation. And I would now like to pass the presentation over to Reverend William Johnson.
Thank you, and good morning to everyone. I am Reverend William Johnson, and I serve as a pastor at the Sharon Baptist Church of Baltimore, as well as community chaplain for the Johns Hopkins Baby Medical Center. And I'm honored to be your moderator for this hour of sharing on church reopening, lessons learned from a pastor, plus insight from both a health and legal professional. The pandemic known as COVID-19 has had an effect on every aspect of our lives, including our spiritual and religious worship experiences. Many church buildings had to be closed to keep parishioners safe, and churches have either recently reopened or are now making plans to reopen buildings. With that in mind, our panel will share with you some health-related, legal, and practical considerations that you may want to incorporate into your plans as the virus has continued to spread at varying rates, and as you seek to create as safe a worship environment as possible. Let me first thank our co-sponsors, the law firm of Whitefoot, Taylor & Preston, and the East Baltimore Clergy Health Resource Community Collaboration, or HRCC, which is moderated by Pastors H. Walden Wilson of Israel Baptist Church and Marshall F. Prentice of Zion Baptist Church. We have an extraordinary and highly accomplished panel, so I will not share their entire bios, but we are blessed to have leading off with health considerations, Dr. Panikis Galiasatos, or affectionately known as Dr. G, who is assistant professor in the Division of Pulmonary and Critical Care Medicine and co-chair of the Johns Hopkins Health System Health Equity Steering Committee with the Johns Hopkins School of Medicine, and he's a co-founder and convener of the Medicine for the Greater Good at Hopkins Hospital. He will be followed with legal considerations by attorney Erika E. Cole, with over 20 years experience. She is author of the Church Attorney's Guide series. She's on the editorial board of Christianity Today's Church Law and Tax Report, and leads Whitefoot, Taylor & Preston's Churches and Faith-Based Organizations Group. And then finally, we will hear one church's experience of reopening from Dr. Marshall F. Prentice, who for over 30 years has served as the beloved pastor of the Zion Baptist Church and is a highly respected faith leader in Baltimore whose advice and counsel is sought by many and who is actively engaged in improving outcomes for all of Baltimore citizens. He is truly a fervent servant of the Lord. And since this is a gathering of churches and church leaders, it's only right that we would open with prayer. So if you take just a moment as we pray. Gracious God, we come in the mighty name of your Son, Jesus, thanking you for this opportunity to gather, share, and to learn ways by which we can continue to serve you, gather in worship of you, and call others to life in you in a manner that is both safe and in this litigious time wise in the midst of a pandemic. We pray for each presenter, listener, and for all who have been infected and affected by COVID-19. We pray that you will be glorified by this gathering. In your name we pray. Amen. We want to take a moment just to remind you that we are sharing general practices and suggestions, but you should not consider today's presentation to be advice of counsel or medical advice from any of the presenters or sponsors. For specific medical or legal needs, you should engage your medical provider or your attorney. And with that, we'll take a look at our agenda. We will have health considerations presented again by Dr. Panikis Galiasatos, legal considerations, Erika Cole, and one congregation's experience, Pastor Marshall Prentice, That will be followed by a period of questions and answers, and then our conclusion. Again, welcome. And with that, we will turn it over to Dr. Panagis Galisatos with health considerations.
Excellent. Thank you so much. It's always good to be on these calls with friends. My dear friend, just confirm that you can hear me.
Can hear you.
Yes, I can.
Perfect. Thank you all. So I'm going to spend the next 15 to 20 minutes just talking about COVID-19, a disease that we've all heard countless times since March, and I imagine many of us actually potentially feel like experts in it. And I say this because it is a new disease caused by a new virus that every scientist and physician is trying to gain expertise in. What I will do over the next 15 to 20 minutes is provide you all some understanding of the science that gives us insight into why we are where we're at today, and then give you a consideration for what your church and congregation can begin to do as we phase in and what that means. And then finally, offer some resources at the end that everyone is happy to access. It's all free. It's really just meant for the community. So with that said, let's backtrack a little bit and have a deeper understanding of COVID-19, or at least enough information to understand, well, how did we get here? So the first thing that I want to bring up is kind of an understanding of the terminology. So the virus that we're talking about is called SARS-CoV-2. SARS, an acronym standing for Severe Acute Respiratory Syndrome, CoV standing for coronavirus, and 2 because it is the second. There's a genetically similar cousin of it called SARS-CoV that came about in 2002, 2003. It caused an epidemic around that time, never a pandemic. And you may be asking yourself, well, why didn't it become a pandemic? Oh, we're going to go over that. So SARS-CoV-2 is the virus. The disease it causes is COVID-19. This is analogous to how HIV, a virus, causes AIDS, a disease, a syndrome. So COVID-19 means you have the virus and you have symptoms. Can you have the virus without symptoms? Yes, and that's just an asymptomatic carrier of the virus. So how did we get here? How did we create a pandemic? Or how did the virus create a pandemic? There's a few things to recognize about the virus's biology that made it just, had all the stars aligned to becoming a pandemic. The first one is knowing that this virus is what we call a zoonotic virus. Zoonotic being a medical term used by our virology friends, or those scientists who study viruses, meaning that began in another animal, mutated, and came into human beings. Zoonotic, so zoo is actually Z-O-O, a term that you hear constantly, right? Zoo, for instance. It's actually Greek, and coming from a Greek physician, it always makes me smile when I can teach some Greek words to others, but zoo just means animal. That's all it means. So it just implies that this virus began in an animal, mutated, and came into a human being. You may ask yourself, well, why is that important? It's important because that means our immune systems were caught off guard. It's the first time every human being's immune system came to learn about this virus and said, well, how do we react to it? Is this a bad virus or good virus? Is this going to cause us harm or not bother us at all? So everyone's immune system was caught off guard. There was no prior immunity. And so that virus took advantage of that in regards to the morbidity that it resulted in. The second understanding of this virus is how it's spread. That's very key because, for instance, if this was more of a GI bug, yeah, it probably wouldn't have gone to the level of a pandemic. It would have ravaged places with poor, for instance, sewage systems, but never would have gone to a large-scale pandemic. But being a virus, being contagious through kind of an airborne discussion, right? It's out in the air, you breathe it in. That's what's made it so contagious. I say this because of all the way viruses and bacteria and infections can go from one human to another. Being transmitted with every breath is by far the most contagious an infection can be. And so that's a second property, right? Because that means in close proximity to one another, one person breathing out means another person is just as easily going to breathe it in. And the third part has to do with the infectious period, it's known as the incubation period, from the time you get it to the time you develop symptoms. With all the review of all the patients in the world who've had this virus result in the disease COVID-19, the best we can come up with, right, is that on average, it takes around 10 to 14 days for someone to get the virus to develop the symptoms. And that's key to know because it's what dictates the public health requests of quarantining for 14 days. It's because as much as data as we're gathering in a virus that everyone has only known about for about 8 months, it still seems to hold true that around 14 days is when you're no longer than 14 days is when you're going to declare yourself if you're going to develop symptoms or not. So the incubation period, right, that dictates how long someone should stay quarantined for. Now, if you develop symptoms, then you have COVID-19. And this is the part then we'll ask you to isolate if your symptoms are minimal enough where you can just stay home. But if they become more severe, then we ask you to go to the hospital and receive care and treatment. Now, this is where this virus becomes even more unique. Majority of infections spread when you have symptoms, such as a cough, a runny nose, a sneeze, right? A fever, right? Your virus causing symptoms is usually also means it's at its most contagious. This has actually been why we were able to do so well with SARS-CoV back in 2002, 2003, and then another coronavirus, MERS coronavirus, 2013, 2014. We identified people with symptoms, we isolated them, and we stopped the spread of the virus. Why couldn't we do that with this virus? Well, we tried, but then we realized that this virus can spread long before people even develop symptoms. That is a curveball by Mother Nature that has thrown us for a loop. I mean, if you think about it, some of you listening to this call may have the virus, have no idea about it because you don't have symptoms, and you go around spreading it. This is kind of another analogy similar to HIV, right? If you remember the 80s, people may have had HIV for months to years before they were discovered to have it because finally a disease would develop that caught their attention. But prior to that disease developing, HIV was just being spread around from one human to another. So viruses can be spreading in an asymptomatic way, and that's really, really, really what makes it so hard to control. Because now the game is, how do you appropriately isolate people if you don't know who has it? And really, the only way to answer that is through testing. The other part that I want to emphasize here, so those were all the key ingredients, right? It's zoonotic, its incubation period, it can take up to 14 days, but it can also spread when you're not symptomatic, and the fact that it spreads just through the air. That all of those are key ingredients to becoming a pandemic, in every scientist and physician's opinion. And then the last part that I want to emphasize is that if people do develop symptoms that are severe enough that land you in the hospital, 8 months into this virus, we still don't have a cure. We have some good therapies that can help us allow people to survive, but there's no cure, right? There's no, the equivalent of an antibiotic for a bacterial infection. We don't have an antiviral to fight this virus. So we offer a lot of good supportive therapy and hope the patient's own immune system will take care of the virus. The reason why I say this is because most people that come into the hospital are usually there for weeks to months on end. And that breaks my heart, right? Because that means hospitals get overfilled very quickly. Think about it, if you just keep adding 5 patients a day with COVID-19, probably about after several weeks, your hospital's at max capacity, mainly because those initial patients haven't left yet. And you have to have a lot of resources around COVID-19. So why, with that knowledge, are we doing what we're doing? Like for instance, today, the community engagement is because as a critical care doctor, I need to work with you all, work with the community in order so that you can understand what actions you can do to put this pandemic behind us, to stop its spread and to appropriately allow our families, our neighbors, our communities to somewhat assimilate into these new times. And so that's why I'm here. So now we're going to talk about, well, how do you begin to live with this virus? And we're going to talk about it explicitly through the angles of a congregation wanting to reopen. So this pandemic, if you've noticed, is unlike any other natural disaster, right? We've had a natural disaster last week in Baltimore when a hurricane came. Well, what's different between a hurricane and a pandemic is a hurricane is limited to a geographic area and to a time, right? You know it's going to end, and it might not be as bad for some places versus others, but at the end of it, there is an ending. With this pandemic, we don't have an ending in sight. The worst estimations that I tell my friends and family, and they cringe when they hear it, is that this may take up to 4 years for us to feel like a new sense of normal. And a lot that's driving that is well, how much resources we can put to vaccines. So all that said and done, the reason why I bring this up is, yes, it is appropriate to try to figure out how to phase in, how to assimilate into the new times that we are in without putting people in harm's way, right? Saying let's all just go back to normal would result in thousands to millions of people getting sick all at once and dying unnecessary deaths because we just didn't have the resources to help them. No one wants to do that. No one wants to feel responsible for a life lost. So there is a responsible way of phasing it. And for congregations, we've worked with them for the last several months because I'm in a firm belief, like, hey, help people's spirituality, that helps their mental health, that helps their well-being, help them leave with the good Lord, but not with the virus. So how can congregations phase in? And so these are the recommendations we've been saying when we've talked to congregational leaders, from rabbis to imams to reverends and priests and so forth. So the first request is to recognize that out of your congregation, try to identify 2 to 3 to 4 people, definitely more than 2, to be identified as COVID-19 leaders. The reason why I say that is these individuals, and they could be anyone from any background, will act as a liaison between COVID-19 information and the congregation. At the end of this, I'll provide resources where they can continue growing their COVID-19 insight and so forth. But having COVID-19 leaders in the congregation is going to be valuable for several reasons. One, they're likely to be the peers of everyone else in the congregation, and they're going to already have the trust of that congregation. So the more they can disseminate factual and actionable information, the more the congregation can continue aligning with the public health requests made by the CDC and the NIH. This is great, because if you're in accordance with those requests, you're unlikely to get the virus, and you're unlikely to end up in my intensive care unit struggling for your life. So that's why we love helping the congregations identify their own COVID-19 leaders. And these leaders, again, to act like a liaison between information and the congregation. The second request is really under the category of infectious control. So under the category of infectious control, we break it down into 2 groups: how to manage symptomatic congregants and asymptomatic congregants. The symptomatic congregants is the most straightforward. If you have the trust of your community, if everyone wants to do well for one another, then please lay out, hey, if you have a new cough, a new sneeze, a new fever, stay home. Yes, could it be something else other than COVID? Of course it could. It could be your allergies. But talk to your doctor first, get his or her stamp of approval, and then let us know. But at this moment, if anyone has a new respiratory symptom or fevers, they should just stay home, right? The likelihood of you having COVID-19 is higher if you have symptoms versus those without symptoms. So if you have symptoms, make sure your congregation recognizes, please stay home. We'll streamline, we'll YouTube, we'll do something to make sure you receive the good Lord that day. So then what about infectious control for persons without symptoms? I already told you one of the most diabolical things about this virus is that it can spread in people without them even knowing they had it. And so this is what we request. Under the infectious control policies for asymptomatic congregants, 1, have a face mask policy, right? And by the way, there's new studies I know that came out about face masks, and the quality is going to be important of the face mask. I agree with you. And if your congregation needs face masks, let us know. We're happy to. We have tons in my office right now. I have over 1,000, so happy to share. But face masks stop the spread of what are called aerosols, right? These are the surgical face masks. Aerosols are clumps of water, and in those clumps can be tons and tons of concentrated viruses. So think about a raindrop. A raindrop's about 1 millimeter in diameter. Aerosols can be anywhere from 0.006 millimeters to as small as 0.00001 millimeters. Very, very tiny. Your face mask won't stop that. But those aerosols actually aren't that big of a concern because it doesn't have that much virus in it. The larger the aerosol, so 0.006 to 0.010, I know we're talking about small quantities, but those aerosols, think about it, a larger drop of water will have a ton of virus in it, concentrated in there very nicely. Your surgical masks, face masks, will stop that. Best face masks, 2 layers with all the integrity of the face mask preserved, meaning no obvious holes, and it covers your nose to your mouth. Has to cover your nose, has to cover your mouth, because that's where air leaves out. So full face mask policy. Second is hand hygiene. Have everywhere as accessible as you can hand sanitizers. If you are very mad about this virus, it's robbed us of our humanity at the moment, take it out on hand hygiene, right? Get it on your hands and just really vigorously scrub your hands. I tell that to everyone. Why? Because you're actively killing the virus. You are killing the virus every time you use hand sanitizer or wash your hands. So make sure your congregation has as much hand sanitizer as possible. I would even recommend it before they walk in, they hand sanitize, and as they're walking out, hand sanitize. The third request is physical distancing. So trying to have, this is where your COVID-19 leaders will come into play. They'll monitor people as they come in and try to keep them 6 feet apart. Now, if it's a family, right, and they've been quarantined and together this entire time, they live together and so forth, yes, they can stay with each other and they should be 6 feet apart from the other congregants. That's huge in regards to keeping people as far apart as possible, recognizing it's going to be hard in a public place. The next recommendation is the time factor. So all of our recommendations about face masking and hand hygiene and physical distance in an indoor place has a time variable where your chances of catching the virus will remain low until you start staying there too long. Reason being for this is because in indoor areas don't circulate the air like an outdoor area, right? Outdoors, think of the outdoors like like an ocean. If something, falls in an ocean, it's carried off and it's gone forever. If something falls in an indoor pool, it just kind of recirculates. Same thing with an indoor building, just keeps recirculating the air. So an hour or less, everyone's safe if they follow the face mask, hand hygiene, and physical distance policy. 2 hours, yeah, you're still doing okay. 3 hours, now you're pushing it. 4 hours, now your chances go from mild to moderate. So one thing I've been strongly encouraging to all the congregations is to fully recognize the time factor. 1 to 2 hours, fair, that's fine. Past 2 to 3 hours, now you're increasing it. Then after 4 hours, you're really putting people at risk. And then the last factor for infectious control is how many people, right? The more people you allow in, the higher your chances of someone bringing in this virus. So what we recommend is allow, first of all, how many people you can put in your building that your own regional government has requested. So if it's your county, your city, or your state that said, hey, no more than 20 persons should be your cap. Then with that said, look at your building. If you have a building that's the size of the Taj Mahal, yeah, you're gonna have no problem fitting in 20, but no more. Don't try to keep adding more people if the government's request is 20. Versus if your congregation building is no bigger than, say, my office, then don't try to put 20 people in there if it's going to violate the physical distance rule, right? So that last policy is follow the cap of either the state policy or how many people you can safely put in that can stay physically distant. So our guideline number 2 on infectious control goes over face masks and hygiene, physical distancing, time, how long to keep people in a building, and finally, how many people in the building. Our last 2 requests, so we went over identifying COVID-19 leaders, we went over infectious control. Third, I would strongly encourage what we call contact tracing. So what do I mean by that? So say you have a congregant that came in on a Sunday, great worship service, and then on Wednesday, he developed a fever. Calls his doctor, who gets COVID tested, and it's positive on Thursday. And so our heart sinks because he's probably thinking, oh my gosh, I was just at church Sunday. So using the trust of your community, what I would say is talk to all your congregants where they will feel comfortable that if they come on to church on a Sunday, they write their name down, kind of an attendance sheet. Shirley Jones was here today. You know how they say was here today, but just sign in. And if someone gets infected on Wednesday, that they anonymously can call the reverend or the spiritual leader or the COVID-19 leaders and say, hey, you don't have to tell them your name. You do not. You just have to say, I was tested positive for COVID-19. Can you let the congregation know? And all that COVID-19 leader has to do is look to Sunday's attendance sheet and say, great, let me start calling these individuals and let them know to take appropriate action. That's it. No one's name has to be given out. That's not what contact tracing implies. It just implies you are notifying people that were in an area, in a building where someone tested positive. And we say this because it's one easy way to mitigate the spread, right? If that great congregant calls you and says, I got tested positive, don't need to collect a name, call that congregation, everyone takes the appropriate steps of quarantining, and guess what? Now the virus doesn't continue spreading. That congregation doesn't become a super spreader. You've stopped it. You've stopped it right there. So contact tracing is number 3 request. And finally, our last request is actually what we call rehearsals. So in this one, we ask the leadership of the congregation, in addition to the COVID-19 leaders that they've identified, to try to talk to each other once a week, if not go into the building, for no more than an hour, and just play out what this looks like. What does it look like if we bring people in? What does it look like? How will we keep people physically distanced? How would we approach a congregant whose face mask has fallen? Right? Just the more you rehearse it, the more when Sunday or Saturday or Friday rolls around, you're prepared to help people out. That's it. And the last part, you may say, well, Dr. G, the long Greek name I go by, Dr. G, given me a lot of great information. How do I help? How do I begin? And one of the first things you can do, and we'll make sure that you get this information, is join our community calls. They're every Monday at 3 o'clock and every Friday at 11 a.m. They'll be created into podcasts as well. But for an hour, we go over current COVID-19 updates. We have a physician or scientist or community leader talk about some COVID-19 related issue or just other health topics. And then we finish off with a meditation, oftentimes presented by my dear friend Will here. So we're here to help. We'll have plenty of resources to advocate for your congregation. And at the end of the day, we're all in this together. We don't have a vaccine, we don't have a cure. The best way to fight this is to just not get it at all. And so with that, I, my friends, turn to you and say, you now are all officially frontline staff, right? Because frontline is the first people that can help stop the spread. I, as a doctor, I'm your last line. So with that said, I turn it back over to my colleagues.
Thank you so much, Dr. G, for your presentation. And at this time, we're going to turn it over to Ms. Erika Cole, legal considerations.
Thank you so much, Reverend Johnson. Thank you so much, Dr. G. I thoroughly enjoyed that presentation and took some notes on my end as well. So grateful to be with you all today and to share on the chief legal considerations in returning to in-person church gatherings. What does it look like to reopen from a legal standpoint? You've heard and hopefully are able to see this slide. My practice has focused for over 20 years on the representation of churches, ministries, faith-based organizations. So whether that is a mosque in Virginia that is figuring out its transition plans, whether that is two of the largest synagogues in the state of Maryland that decided to merge, whether it's hiring, firing of staff, whatever it is that involves faith-based organizations, that's what I do every day. And so obviously when COVID found its way to our shores, shall we say, and all of the issues surrounding churches needing to close and now bringing us to this place, it's very interesting because my first webinar on churches reopening was back in May. And one thing about COVID time, it seems like it goes ever so slowly in some ways, but really when we look back to March, I mean, it feels like a lifetime ago. I'd certainly never the word coronavirus, had never heard of COVID-19 until, March. And now there's a whole new vocabulary that all of us have, for better or for worse, become quite familiar with. And while we have learned so much, there still seems to be so much learn. The nature of it being a novel virus, as the doctor has said, is that we're still trying to figure it out. And certainly, from a legal standpoint, things are still unfolding. But I trust that I can share with you some important takeaways from today's presentation. So let's start with the question of what are the chief liability considerations associated with returning to in-person gatherings in this current COVID-19 era. In short, and unfortunately, the chief concern is that someone comes to church and they get sick, right? Or maybe from a more litigious approach, someone claims that the church was liable in them contracting COVID-19. Or perhaps maybe the person who attends the church doesn't contract it, but maybe someone in their household does. And perhaps that could be a minor or an elderly person or someone with a more challenged immune system. So when we talk about liability from a legal standpoint, we're considering how and if the dots can be connected between one's contracting of this novel virus and the innate harms associated with it, and some conduct by the church, or perhaps a lack of proper conduct by the church. So this is what we're addressing here now. Again, because this is a novel virus, and just like from the medical standpoint, the medical community is becoming familiar with how to treat it. The same is true from a legal standpoint. We have begun to see some cases matriculate through the court system to get a sense of how the courts may treat claims around COVID-19. And so we can prepare ourselves as we learn more. So let me just say, one of the challenges that we have seen, or one of the questions that I have gotten, is particularly around the shutdown and churches not being able to assemble, or not being able to assemble in the time, space, volume of people that they desire. And some people have suggested that that's a violation of a church's First Amendment rights. And so if we consider what it may look like for COVID-19 versus the Constitution, the reality of what we're seeing now, we have a couple of cases that have matriculated through the court system, and the courts have determined, in fact, the highest court, the Supreme Court, recently rejected 2 lawsuits stating that state restrictions on worship violated the First Amendment's guarantee of freedom of religion. So at the same time, many states and local governments have carved out exemptions for religious institutions from pandemic-related restrictions. But what we're seeing is that when governors, mayors, leaders, government leaders have made, for health reasons, the decision to close churches, so long as those decisions are not aimed directly and solely at churches. Generally speaking, the courts have found that these pandemic-related restrictions are necessary and are not a violation of First Amendment freedom of assembly, religion, or etc. So we should sort of check that box in our minds, recognizing that courts are rejecting those cases currently. Now, we do also want to consider on the front end, any kind of liability risk, whether they can be mitigated by insurance coverage. And I had someone ask me, what's the relevance of insurance in this conversation? And the principal consideration is that if you have a policy that would step in, I'm getting some feedback here. I'm not sure where that's coming from. If you have a policy that would provide protection, or more specifically, provide coverage for a lawsuit, that lawsuit perhaps could be negligence, right? Where a plaintiff is saying the church was negligent in its timing of opening, or any of those things that Dr. G said, right? Not having a face mask policy, having too many people in the space, not following CDC guidelines, that kind of challenge. You would want to be able to raise this with your insurance carrier and see if your church has coverage. That's always, in the nature of litigation, the first place to start, right? As I often say, insurance is one of those things you want to pay for but never have to use. But if you need it, you want it to be there for you. So check your insurance coverage. Now, if you don't have insurance coverage for COVID-19 related matters, you're probably not going to be able to get it at this point. Obviously, insurance companies are often wanting to pay as little on policies as possible and deny coverage where they believe it's right to do so. So they're certainly not in the current era granting people, at least that's been my experience, they're not extending this kind of liability coverage going forward. But if you happen to have it already, it's definitely worth checking. If you don't happen to have this coverage, the second place to look is in your church governing documents, specifically in your church bylaws. As you may know, the church bylaws are the governing document for how the church operates, and hopefully you have a provision in there under the guise of indemnification. And indemnification, we can even use a spiritual analogy, it's someone stepping in front of another to take the blame. And we certainly have an example of that in our faith. So more specifically, how it applies to churches is you would, the church itself would step in front of any individuals. Let's say the board itself were sued as a part of any claim against liability, and they would, so the church itself would provide, would fund any defense of any liability. So those are places that we would look. Now when you consider the return, you certainly want to have a phased-in approach, right? I would really have you consider looking at the legal considerations of the facility and start off perhaps with the employees, the staff, key leaders, right? So as a practical matter, there's probably a greater need for these individuals to be present. And, since this is presumably their place of employ, or even if they are individuals who are volunteer staff, but it may be necessary to have them there. If they're an employee, you got to also consider remote work data security concerns. So the church giving records, credit, debit card numbers, etc. It may just be practical to have some of these key persons in the facility when local laws allow such, and enroll them in first. And I would distinguish that from employees or these individuals from perhaps third-party service providers. So you probably don't want to have a whole lot of people coming in dropping off things. Maybe you would normally have delivery services and things of that nature. You may want to minimize those things. Obviously, when you talk about cleaning staff, and we'll hit on that some more, the CDC has certainly indicated that scaling up operations in cleaning, disinfection, and ventilation is highly advised. So then when we talk about the congregation, the actual membership, again, you must, I strongly advise that you follow all federal, state, and local laws. Again, speaking here in Maryland, we know that there are some jurisdictions that have had higher COVID rates than others. So if your church is in one of those jurisdictions, you likely want to have an even heightened level of phased rollout and maybe really keep it very slow, succinct, in small numbers for a good period of time. So if you consider the CDC actually has really good information. They have it under the considerations for communities of faith. And so one of the things that they talk about is promoting healthy hygiene practices, which again, we've heard Dr. G speak of, mask or face coverings, intensifying cleaning, disinfection, and ventilation, promoting social distancing. It's difficult to imagine, but minimizing community sharing of worship materials and other items. So even though, you know, when I go to church, it would be common to get a bulletin as I come in. You're probably better off not doing that right now. Probably also not having hymnals or, you know, or any religious texts or bulletins or books or any items that would be passed. You're probably also not going to be having communion likely in the traditional sense or those kinds of practices. And of course, often we're close-knit, right? So hugging, shaking hands, you know, all of those things are probably out right now. It's also likely that you're not going to, in the initial phase, probably initial phases, you're not going to be having nursery or childcare. It would certainly be something that most churches would need to adapt to on the front end. And then finally, the importance of staff training. That's sort of suggested again by Dr. G, whether you create a COVID-19 team or whether this is something that you make available to all of your leaders, your staff, but creating that secure environment and then having good communication with your members and volunteers and staff, it's really going to be critical to the health and safety of all the people involved. Now, let me just say, one of the questions I've gotten is from one of my church clients is, can we take temperatures, right? Can we have people, you know, can we just have a system where we take everybody's temperatures? And the answer is yes. I've not seen anything legally that prohibits that at all. And I think there are plenty of reasons why that makes sense. So I will also say, if you, as a church, that you're not comfortable with that approach, many in the business world require that their employees take temperatures before they would be able to come in to the office. So you could require that the individual take their temperature, but, you know, obviously that certainly is going to very much be just kind of a trust thing, right? Certainly there would be no way to verify. Another question that I've received is whether the church can have a policy requiring the wearing of a mask. And again, legally, I've not seen anything to the contrary that a church could not have such. And then when it comes to meeting indoors, again, it very much is important that you follow social distancing and all of those things, but I would suggest that the church have a way to allow people to register in advance of attending. A lot of my churches that are that have decided to have in-person gathering are utilizing online registration. And that has many benefits. Number one, it helps you control the numbers, right? So if Maryland right now is at 50%, the current regulations are generally speaking 50% of your church's capacity. So if you're a church that has a capacity of 300, then obviously you've got to limit your attendance to 150 people. So you don't want to just open the doors and then have long lines. You probably really want to be able to control the numbers by having some online registration. That also, again, affirms the ability of contact tracing. And then once you have those individuals, that 150 people at max registered, you want to just print out that registration, and as they arrive, you can then check off who's actually there. And so you want to, again, just make sure that you're being very judicious. And as a practical matter, again, I'm not going to go through an entire plan in this short time, but most churches have now, like what you're used to seeing in the grocery store, you're going to put down the markers to show how people come in, where they are able to maneuver. You probably want to have some areas blocked off where people can't sit so that it's properly distanced. Have very clear indicators about doors, entryways, and exits, and keeping those things separate. Now, from a legal standpoint, there are different considerations based on the type of facility the church has. So if you own your facility, then presumably you've got a wider level of flexibility on usage, right? So you're going to be focused on the state, federal, and local laws about when you can open, how many people can be there, et cetera. If you rent, there may be some additional considerations, right? Because you might have the additional questions of, am I still required to pay rent during the pandemic? And again, that can vary by jurisdiction. You may also have a landlord that may be more restrictive than the local governments, or perhaps more lenient in terms of when the landlord would allow you to open. So all of those things I think are quite important. And the same for like a mobile or pop-up site. So if it's a church that would traditionally meet in a school or in a theater, et cetera, those are very specific, quote unquote, retail spaces. So there may be additional considerations around that. So it's going to vary really by the type of facility the church has as well. So I'm looking at the time, so I'm going to start wrapping up here. Let me just mention that our firm has a conference each year. I think I started the conference about 12 years ago. And this year we are merging our firm's conference with an accounting firm, Aronson, and we're presenting the Church Law and Finance Conference. And so it's going to be a virtual event that's focused on reinvention and renewal. I think that really speaks to the reality of the times in which we live. So we're going to be talking about churches in distress, legal solutions to today's challenges. We have a keynote speaker who is kind of the godfather in the church law arena, if you will. We're going to talk about racial reconciliation within the church, virtual reality within the church since this heightened online presence, protecting our houses of worship, the reentry process, and ministry in an unstable revenue environment. I mean, these are just the realities that churches are living through right now. So I will pause here. I'll look forward to taking any questions when we get to that point together. Thank you so much.
Thank you so much, Attorney Cole. And now we're going to have about 5 minutes from Dr. Marshall Prentice, pastor of the Zion Baptist Church on their experience.
Thank you, Dr. Johnson and Attorney Cole. I want to thank you so much for great information. Dr. G was learning quite a bit. I want to say thank you to all of you and say good morning to all. One of the things I would like to share in the reopening at this time for us here at the Zion Baptist Church, I am blessed to hear what I've learned today from Attorney Cole. Some of those things we truly have already been in place here at Zion, and what we've learned from Dr. G, and tried to make sure that we've been trying to adhere to what we've learned. For us, we've been very much concerned with the safety of the people, of course, and by being a church, we know that we are a faith-based institution or organization. We learned, of course, that we must give people faith, but faith is knowledge and wisdom, because we have learned that our people perish from a lack of knowledge, and knowledge is learning to do what we learn, and wisdom is how to use what we learn and apply it into practice. During this COVID-19, through the guidance of the Holy Spirit and the leadership of our officers, we put together, after having much time of prayer and meeting with the leaders of the congregation, a book, a training manual, as well as a informational book that would help our members as they are entering into the space of worship and meetings here at Zion. So we try to do what we've heard today from what our presenters have already said. We put together making sure we follow the CDC guidelines, our government reopening guidelines, city and state. We looked at the guidelines that we have learned just from being here at Zion through our own health ministries of putting some health protocols for attendants, health protocols for employees, and cleaning protocols. So we put those in a book manual that we could pass out and share, and following what we've heard from Dr. G, we tied in our leadership of our officers at Zion, who are pretty much our monitors, our liaison people, to help pass on information about this COVID-19, and then to help us with what we do, the effective potential controls, to put those in place, that in our attendance we have also a questionnaire that we ask our congregations, and we don't mind sharing that information for the protection and safety of our congregants. So what we have put in place is those things that you've heard today with sanitizing the guidelines, custodial checklist, or cleaning our buildings from top to bottom daily. If we're doing, as I said earlier, a pre-screening questionnaire. And then we also do a temperature thermometer testing with a no-touch thermometer. And I was glad to hear Attorney Cole tell us that that is something that we can do without having any fear of being liable or having members say that we're going against breaking, violating the law. So we try to make sure that these things are in place. I've been blessed because the leadership of God that comes from spiritual leaders here at Zion, and our relationships with Johns Hopkins and others who have helped us to put information together for the best practices for the health care and welfare of our church and our church community and our families. So we've been blessed to say that we've opened our doors from the very beginning. We follow the practices of putting markers in the pews, making sure that we looked at when it was 10. We only had 10 that was in attendance. We had our deacons, trustees, ministers, musicians, technicians for audiovisual, multimedia, and we had someone from our health ministry. And that way we could provide worship service online to our congregation. And then when we went to the 50%, we looked at 50% of occupancy of what our church building could hold. And then we did the marking based on that for the social distancing and making sure we also had in place, you must wear a mask, you must have a mask. We had masks that if you did not have one coming, someone would give you that because you could not enter in without a mask. We've been blessed by having these practices already in place that when loved ones get transition or members of the congregation or family members and they wanted to do the homegoing service here at Zion, working with the morticians, we were able to keep in practice what we do on Sunday worship. And then that way we could move forward with blessing the families when it was 10, when it was with the 50%, and now the 25% for the safety of the congregation. Now, some of our challenges are still things that we have to do our best in working with. We also have to help people understand that when we are trying to follow the restrictions or guidelines, we're only doing it for the healthiness of the congregants, for the family, and the congregation. When we're doing homegoing services, they're not always with members of our congregation, and therefore you have some who are sometimes reluctant to follow the guidelines, and it puts us in an awkward position because we are trying to empathize with the families, but we're also finding that we have to do as much as we can to enforce these practices for the safety of all who are entering in. We had one service where the one gentleman did not want to wear a mask. He did not want us to check his temperature with a no-touch thermometer. And when we do that, we don't look at the temperature. We show that to the person who is coming in, and then they can determine if they have a fever or not. They can let us know, and then we suggest to them whether they should not enter in, go home, have that checked out. So those are the things we're putting in place, but you're always going to meet up with some who do not want to honor the request or be in compliance with what restrictions we have for the safety of the congregation. In our blessings, I can thank God that we have a custodial staff who have been trained to go through and do all that is necessary on the daily practice on going through the building and having a policy in place and sanitizing all the equipment, every place where folks are entering in, and doing that every day from top to bottom. Cleaning the church when people are entering and when people are leaving. We make sure that we have one entrance place where you can only enter in one place and you have to exit on the other side. When we do communion, we do a practice with having, as what we learned from our attorney, we use those communion cups that are not opened by anyone but the individual. They are given to people when they are entering in. We also have a place where we encourage the congregation who's watching us online to get crackers or a piece of bread and juice and to join us in the communion practice. We try also to follow what our attorney has said, where we do have worship guides, but we limit them. We don't have anyone use the hymn book. We put everything on the screen. We put all announcements on the screen, and therefore we try to minimize, as she stated, on any handouts or touching anything. We have a no-touch policy in place where not even at times do we do the elbow, a Baptist bump, we call it, because we're trying to encourage people to keep the mask on not as a chin guard, but as a full mask covering your nose and your mouth. We're touching church, but we have encouraged people to refrain from touching at all. We are making sure that not only are we wearing masks, we have hand sanitizer when you enter the building on a stand, and when you leave the building, there's a stand where you can use the sanitizer coming and going. So we put these things in place. We have a staff of congregation, within our congregation, of volunteers on our security team who are helping people, passing out information for their safety and for following the restrictions that we have in place, following the guidelines of our city and of our state. So that's what we're doing, and I can say that I'm so thankful to God and to leadership team here at Zion that has allowed us to never miss a Sunday and doing what we've been called to do, to share the word of God and to encourage the people of faith to walk by faith and not by sight. So I want to thank you for what we received, and we're open to any questions that you may have for us.
Thank you so much, Dr. Prentice, and thank you to all of our presenters today. And unfortunately, we have gone beyond time, and so I'm going to turn it back over to our organizing host, who will give us some final information as we leave.
Thank you, Erika, Reverend Johnson, Dr. Pinkerton, Pastor Brenton. Thank you for attending today's webinar, Church Reopening, Lessons Learned from a Pastor plus Insight from both a health and legal professional. Please email your questions. We ran over, so we didn't have time for Q&A. And on behalf of Whiteford, Taylor, and Preston, HRCC, and our presenters, thank you for joining us today, and stay well.
Thank you.